Gauteng Health MEC Bandile Masuku is promising to tackle the challenges faced by patients and employees at Mamelodi Hospital. 4 employees have been placed on special leave for the shackling of 76-year-old Martha Mare. Her family has laid a criminal complaint against the hospital.
You have made a promise to this family that you're going to get to the bottom of what exactly transpired. We know that 4 people have now been held somewhat accountable. What can we expect going forward?
What we expect going forward is that we expect them to respond to their letters of intention of suspension. And beyond that is to start a full-blown independent investigation on the incident itself. And that will be followed up by a disciplinary process and a disciplinary procedure. But in the meantime, we also engage the family in terms of redress and counseling to make sure, because this is a traumatic incident. Myself, I didn't complete the video. I've not seen it to completion because it's very traumatizing and it's something that is not acceptable that could happen in our facilities. So counseling and redress has been actually started, and we're going to continue with them until they are actually okay.
This is the first draft of the report, but are we any wiser as to why she was possibly restrained?
Yes, I think there is suggestion that she was a bit confused and a bit violent, but like we said, we have standard of procedural things that we have to do, and these were not followed to the T. But I would wait for the full-fledged report after the investigation on the type of medicine that was used, and also what type of restraint were done and why it was done that way.
How long was she restrained for?
The preliminary report expresses like around 8 hours on the 29th at night, and it's something that is very much unacceptable that it had happened to an elderly woman like that.
MEC, this incident has really just raised and cast again the spotlight on the public sector healthcare system. Lots of people, even just here in Esteris and also in Mamelodi, just talking about their experiences, especially at the Mamelodi Hospital. You have also made a promise to Gauteng residents, especially Mamelodi community residents, that something needs to be done about this hospital. Tell us about the processes and the steps that you're going to take. Yes, 3 days into office, so you understand, but what sort of processes are you going to take to ensure that the bad rap that this hospital has received for the longest time, this is going to be something somewhat of the past?
Yeah, like I've said when I was talking in other media houses, that there are 3 priorities that I'm going to deal with. One of the priorities is the issue of staff morale, because I know that our staff, our workforce are quite depressed. They've got a lot of issues that relates to shortage of staff and also being overworked and working long hours. And we need to have a long-term intervention in that, which will be in discussion with staff associations and trade unions. And the other one is just to change the patient experience, so the look and feel of our hospitals. We need to make sure that we're able to deal with the waiting times. We have to deal with the cleanliness and the upkeeping of the facilities. So those are few things that other people might require and might say that are soft targets, but are things that can go a long way in making anyone who comes into a facility feeling that they're going to be healed.
MEC, activists such as TAC, Not In My Name, but various health activists have just been calling for the removal of the board at the Mamelodi Hospital. What's your response to something like this?
I think we have to wait for the whole thing. The board was part of the delegation that came to the House. The only thing is that we need to make sure that the board does what it's supposed to do, and it's supposed to utilize the energies and the intentions of the community to change the health system. Because we can't do it alone as people who are officials in the health department, but we can do with everything. We have committed to work with community workers, with community organizations like TAC, and there are a lot of programs that we're going to run. We're going to do things differently. Health, in actual fact, belongs to the hands of the people. We can only change when the people themselves change how they do things.
Some people have labeled the hospital of death. Very dramatic, I understand. But do you, as the MEC of Health in Gauteng, believe that there is a crisis or a crisis brewing at this hospital?
When you talk about Mamelodi, yes, there are limitations, there are challenges in terms of space, in terms of shortage of medical personnel, and this is something that we are going to look at. On Tuesday, I'm meeting with the DID to just get a sense of what has happened and what is the progress of the projects that are supposed to happen in Mamelodi, but also in other areas